The brethren, they full of energy. Some people say God is a Trinity.
All right, everybody. Thank you very much for staying with us this morning. So, as the Ministry of Agriculture, Land and Fisheries is currently managing an outbreak of porcine, reproductive, and respiratory syndrome, commonly known as blue air disease. All right, so this serious condition affects domestic pigs. All right, so we do have on the line or in studio this morning Dr. Lisa Musai, Acting Chief Veterinary Officer, Animal Production and Health Division. Dr. Musai, thank you very much for coming this morning. We do appreciate it.
Thank you for having me.
All right, so doctor, while some people may be familiar with this, I think that some people may say, well, where did that come from? What can you tell us about this disease? Okay,
so porcine, reproductive and respiratory syndrome, it's a very long name. The vets tend to call it by its acronym PRRS. Sometimes we just pronounce the acronym PRRS, right? Easiest to say. So it actually, that long name describes a little bit about the disease. So it's a disease of pigs, hence porcine. You get clinical signs in the reproductive system and the respiratory system. So in your breeding animals, you would get signs like abortions, stillbirths, maybe even weak-born piglets. And the younger pigs tend to show more of the respiratory signs. So you would get coughing, sneezing, labored breathing, lots of respiratory distress, fever, poor growth, lethargy, weakness.
Yeah.
Those are the signs that you would see.
So, doctor, when was this discovered is it in Trinidad alone or is it Trinidad and Tobago?
It's in Trinidad alone. Right now, we have discovered the disease on one farm, and this was about 2 weeks ago. And since we made that discovery, we have quarantined that farm, and we have been conducting rapid surveillance in and around the area of that farm, and doing what is called epidemiological surveillance, where we're doing some trace backs and trace forwards to try to see ascertain where else we think the disease may have spread if it did.
Yeah, and I suspect the investigation thus far has not shown the disease at other farms
that is correct.
In the area.
That is correct.
All right. So, but I think that people would want to know, how did it arrive in Trinidad and Tobago? How did it get here?
So that's the million-dollar question.
Right.
Even we need to do further investigation to figure that out. So we would have to do further testing to sequence the DNA of the virus and try to figure out where its origin could be. Now, we did have an outbreak last year in the same disease, and it was on one farm in South as well. So we're going to compare the DNA of both virus strains and see, if we can, come to any conclusions on that.
Yes. So you know, doctor, that when you do have and when people hear an outbreak, there is a level of anxiety and panic which this causes. What's your message to members of the public out there who like pork, who like to eat pork?
So it's a very species-specific disease, meaning it will affect pigs only, not other animals, and it cannot affect humans. So it's not a zoonotic disease. Humans cannot get the disease from pigs by handling the pigs or by handling meat or from eating pork, right? Our local pork is safe to eat.
Right. But what do you do, except for quarantining where the outbreak is? Is there a need, and of course you're saying, well, here's what, you can still consume the pork and so on. But is there any other way that, let's say, that the pigs are treated? Is there a need at all to destroy the pigs?
Okay, so there is no cure for this disease. So there's no treatment really for the pigs. And our strategy at this point in time, because it is a disease that we do not want to live with, and because it can have some serious trade implications for us if we keep the disease, if the disease is present in the country, our aim is to eradicate it.
Right.
So we are doing our surveillance. We are looking to see which other farms might have the disease. And this is where we need to really appeal to the pig farmers out there. If they're seeing clinical signs, those respiratory signs I talk about, coughing, fever in their piglets, dead piglets, abortions in their older pigs, then they need to call us at the Ministry of Agriculture, Land and Fisheries, and let us come and investigate on your farm and see what's happening.
Yeah.
Right? We do have a hotline, we do have a hotline that members of the public and farmers can call. It's 280-7945.
Yeah. So the advice is to say something, because if they do not say something, and I'm speaking about the farmers, there is the great potential that they can spread it to other farms.
Yes. So at this point in time, you do not want to be moving pigs around from farm to farm or equipment, because it can be spread from equipment and vehicles that's leaving an infected farm and going to a susceptible farm. So you have to be very vigilant about those things. You need to practice what is called proper biosecurity measures. And we are conducting a series of farmer outreach activities where we are talking to farmers about things that they ought to be doing, things that they ought to be improving on, so that they don't further spread the disease or they don't introduce the disease onto their farms.
Yeah. Let's talk a little bit about that spread, Doctor, and how is it spread?
It is spread directly from pig to pig.
Right.
Right? So an infected pig coming in direct contact with another pig can pick up the virus, but it's also spread indirectly through fomites. Fomites would be like your footwear, your clothing, dirty hands, equipment, vehicles. So anything that's leaving an infected premises and moving out to susceptible premises can carry the virus and spread it that way.
Yeah. So is it safe to say, Doctor, that the ministry, it has the situation contained and it is under control, and that you all are monitoring the situation?
Well, we have the one infected farm contained and under control. Yes. We are still doing our surveillance activities, so we still are trying to determine a sort of island-wide picture of the disease itself. So that's where we are with our activities for our disease response. And one other thing that I would want to say to farmers is that they need to be very, very vigilant and extra careful about where they source their pigs. Mm-hmm. Right? We all know in Trinidad that we have very porous borders, especially our southern borders, and we do suspect that illegal animals are illegally smuggled into the country, right? And this could be one way that the disease got to here, right? So farmers need to be very careful who they source their pigs from, where they get their pigs from, and they should ensure that healthy pigs come onto their farms.
Yeah, but it is also safe to say that from the ministry's investigation, you all have not detected it spreading to other farms, and as the doctor said, the meat is safe to consume. That's
correct. So we've continued our surveillance, and so far it's just that one farm that is showing the infection. We are doing further testing, and yes, I encourage our consumers to continue eating our local pork. It is safe to eat.
Yeah. Doctor, anything else you'd like to tell us before you leave us this morning, maybe that we didn't touch on?
Just to say, to ensure the public that in the Ministry of Agriculture, Land and Fisheries, we are committed to protecting animal health. That's our job. And that we are very committed to safeguarding the pork industry and ensuring food security for our nation.
Yeah. Doctor, could you please remind us of the number that you gave us earlier?
Absolutely. The number is 280-7945.
All right. Doctor, thank you very much for coming this morning. We do appreciate it.
Thank you.
Yes. We are going to a very short break, everybody. We're coming back.